I think one of the ways you would sum up my lung cancer organization mission would be to improve the survival statistics of lung cancer through advocacy, education, and community outreach. I wouldn't say that's always been the case, because quite honestly, when I first came up with the name Breath of Hope Kentucky, it was really just kind of trying to put an umbrella over what I was trying to do, which was really just meet other survivors, become a part of the conversation of lung cancer. When I would advocate for lung cancer awareness, I really wanted it to be on a survivor's terms, because we have our own angle when it comes to looking at this disease. So as it grew and as we became a nonprofit, I would say that's when we that became the cornerstone of our mission. And improving survival statistics of lung cancer is anything I do that has to be at the forefront of why I spend my time doing what I do.
It really is the difference maker in terms of being able to detect lung cancer early, where you can do something about it, and it's at those early stages. And we now have a screening method that is a national guideline that really can guide us to say, oh, we really have eligible people who can benefit from lung cancer screening once they have a conversation with their doctor. So it's hugely important for the lung cancer story to have an early detection option.
I see today, with the addition of lung cancer screening through a comprehensive program that looks at those patients that are at high risk for lung cancer and those patients that are of the right age and have the right tobacco exposure in that group. We find these patients by running them through a CT scan once a year. And by doing that, we're able to reduce the mortality of this disease. And the way that works is because we find them early. And so a small nodule shows up, and before it's a larger mass or something that's spread to someplace else, we have a much better chance of being able to have this in a stage 1, early stage cancer, something that we can remove with surgery, typically earlier in the patient's life when they're healthier, and so they're able to tolerate surgery better. So our outcomes are better with smaller tumors, with younger patients, and so our survival's better. And so I think that's important for all manner of risk factors for lung cancer, understanding radon exposure, understanding tobacco exposure, understanding the family history of patients, but knowing that lung cancer screening is really a program that's designed to find the patients in that highest risk group of folks in the right age group, and in 50 to 80, and those patients that have a large enough tobacco exposure at more than 20 pack years.
Well, it did take about a year and a half. About 6 months into my diagnosis, I went to Washington, D.C. to an advocacy summit, and it was great to meet other survivors in person, but you come home back into your own community and you still feel very alone. The people that I did finally get to talking about lung cancer were people who had lost loved ones to the disease, and even if they had stories similar to mine, they had already passed away. So I found myself being a comfort to those families. And about a year and a half in, a story was done on me, and I talk a lot about how we need our stories to be on bigger platforms. I received an email through the Breath of Hope Kentucky email from a survivor from Hallsville, Kentucky. I don't even know where Hallsville, Kentucky is. And I thought to myself, gosh, if I feel lonely and she's in this really small town, I can't imagine how she must feel. And she was diagnosed earlier than me. But that's the first time I remember how it felt for a survivor to actually reach out and know who I was and want to connect with me. That's what this is building. It's not for everybody. And I hate that there might be some people out there who haven't found us yet. We don't ever want to see a newly diagnosed lung cancer survivor. That's the last thing you want to see, but knowing what I went through for a year and a half, to know that somebody, especially like this newest young member who's 36 years old and was recently diagnosed, to know that she can almost immediately be welcomed into a community if that's what she's looking for, is huge. Because the loneliness and the mental side, it's as much a psychological effect on you as it is a physical effect.
And the Kentucky Cancer Consortium houses our state Kentucky Cancer Action Plan, which is essentially a plan that lets us say, okay, there's a lot of things that we need to do with cancer. So what are we going to do? How are we going to focus on it? And so what we decided to do is we said, you know what, let's reduce late stage diagnosis of cancer, or alternatively, increase those who are getting early stage cancer. And that being done through, in many ways, the early detection and screening piece of things that we've started to talk about already. And by doing that we could see increased survival, increased opportunities for folks. And so what's amazing is that we've started to see some numbers from our Kentucky Cancer Registry that show that since 2014, we've seen a trend line start to change. We've seen early stage cancers start to go up for lung cancer, and alternatively, late stage cancers go down. They're kind of just the inverse of the same story, but it's huge. And so by working together, and that's really what the consortium has been saying we need to do. We've got a long way to go, and there's a lot that hasn't been done. But when we look at screening for Kentucky, and this speaks to kind of our early adoption of really talking about this in our cancer plan, we are now ranked second in lung cancer screening in the country.
You know, it is important for us to understand what are the risks associated with lung cancer. And interestingly, we've seen, even in Kentucky, but also across the nation, we've seen a declining rate of tobacco use, and that's great. Interestingly, when we look at the difference between men and women in Kentucky over the last 20 years, we see a significant decline in men with the incidence of lung cancer, primarily driven by a decline in their tobacco use. But in the last 20 years, we've seen a slight increase in the risk of lung cancer in women. Their persistent tobacco use, especially in younger women, is concerning. But we're also seeing these group of non-smokers with adenocarcinoma that are showing up with lung cancer. And we don't have a good screening modality. We don't have an indicator to be able to say that this is a group of patients that we should be looking for those cancers, but we do find it in them. And so we all have to be aware of symptoms that may come up. Maybe it's a persistent cough. Maybe we have to be aware that there are family history that we need to just think of when our primary care docs are talking to our patients. And I think the other risk factor, the number 2 leading risk factor for lung cancer, is radon exposure in the home. Unfortunately, we're not testing for radon often enough in homes, and so we may miss an opportunity for folks to identify that they're living in a home that has a high level of radon, tested in an appropriate way, that could identify a patient at risk.
I think what I have seen the greatest success comes from getting our message out on bigger platforms. And you'll often find when people get the chance to hear from us, the message gets absorbed, what people have been trying to tell them for so long. Radon's a leading cause in never smokers. You have a never smoker talk to you about that they believe their doctor believes that radon was a contributing factor to their lung cancer. It elevates the validity and credibility of the message. Maybe because we're living longer and we're becoming a more vocal voice, and some of us are living somewhat healthier lives. We are getting more and more vocal and becoming a part of that conversation, but I think that can become a game changer for really helping people understand we gotta move forward working towards that ultimate goal of really helping anyone who can further progress for this disease understand that anyone with lungs can get lung cancer.
Well, you know, a dear friend of mine and somebody we work with often likes to say, and I think it's true, that the future is great, that Kentucky has a chance to be perhaps the greatest comeback story in cancer history and in lung cancer history. And so we've been #1 for new cases. We've been #1 for those who die of lung cancer, but we are now #2 for screening. And we are seeing an increase in early stage diagnosis. We are seeing recognition of other risks that we can reduce, and that can work together. And one of the pieces of our consortium's Lung Cancer Network, when we even started, we said, okay, are we gonna focus on one thing? And everybody said, well, no, because you've got to help people quit smoking. You've got to let people know about radon. You've got to reduce exposure to secondhand smoke. You've got to get access to lung cancer screening, and you've got to make sure there's the appropriate treatment and then quality of life care afterward. So you can't do everything all at once in many ways, but at the same time, you can catalyze everybody to keep doing great things in their spaces and get to know how they complement one another. And so as we learn together, we can work together and keep making this story a completely new story, and a really story of hope and empathy and just reducing stigma and saying, hey, every Kentucky life matters, and lung cancer, let's just get rid of it and do something about it.
I think that it is important for us to make sure that we don't get tunnel vision on risk and say that it's tobacco and it's only tobacco. I think that increases the stigma associating lung cancer with only tobacco, and I think that it's important that we as healthcare professionals all work to break down that stigma associated with lung cancer and be able to get it to a point where it is a discussion about risk and a discussion about benefit. And today, because of our effective use of lung cancer screening and the increasing impact of targeted therapies, we need to talk about the hope of the future.